What's up? You're listening to the Change Truth podcast, where I speak to people about drugs, addiction, and mental health. This time I'm joined by Patricia Bacon, and Patricia is a member of the Canadian Drug Policy Coalition. And just as the name implies, that group is trying to change drug policy in Canada. Why are they trying to do that? Well, basically, Stephen Harper's Conservative government has terrible drug policies in place. It's not helping anybody, and we get into why and why it needs to change. But first, we talk about Patricia and her work with another organization called Blood Ties. And Blood Ties is a group in Whitehorse, Yukon, Canada. And Blood Ties focuses on harm reduction. And that means harm reduction around illicit drug use for the most part. A big part of what she's doing is preventing the transmission of things like HIV and hepatitis C, but she's also trying to help educate these hardcore drug users. This is what we start off with, and Patricia does a much better job at explaining it than I will, so I'll let her do that. So check it out. This is me with Patricia Bacon.
We have a number of key program areas. One of the things that we do is we're working with people around the prevention of HIV and hepatitis C. And so one of the ways in which people can become vulnerable to HIV and hepatitis C is through injection drug use and illicit drug use. So we work quite a bit in prevention around that by offering harm reduction programs and services. Harm reduction is a philosophy that's also a practice, and it takes the approach that illicit drug use does and will occur in any society where you have an aggregate number of people. And it says that, you know, in a perfect world, we wouldn't have illicit drug use. We wouldn't have problematic or chaotic drug use, but that's not true. Mm-hmm. And we don't live in a perfect world. We live in a reality. And so in that reality, we look at harm reduction as a way of helping people to reduce the harms associated with illicit drug use. So there's all kinds of examples that you can use around what that looks like on the ground running, but mainly, for example, if a person is using illicit drugs by injection, and so they inject drugs, one of the ways to reduce harm is to make sure that they use a clean needle every single time. Right. Why would you want to do that? Well, you know, if you inject drugs and I inject drugs and we share the same needle, and I have a disease like HIV or hepatitis C, well, and you and I share that needle, you're going to get it too. So it's a way of preventing HIV or hep C transmission. If I use a clean needle every time, I'm going to have less damage to my veins. I'm going to have less abscesses and problems at the injection site, which means I'm going to not necessarily have to go to the hospital or need a health intervention because I screwed up my veins by reusing a blunt needle over and over again. Other ways that we say harm reduction is if a person is used to, say, injecting drugs, 10, 15 times a day, we might say, well, maybe you might want to try to reduce the number of times you inject. It's not realistic to say to the person, why don't you not inject at all? That kind of thing. So
that is the confusing part, I think, for people when they hear about this. If they're not familiar, it's this idea of like, why are they helping people do drugs, right?
Yeah, why are you helping people do drugs?
Idea. I mean, when I talked to Stephen on the last podcast I did, I mentioned this to him, this idea. And I said, what if the food bank closed down tomorrow and Blood Ties closed down? Are these people going to do less drugs then and be whatever? And his thing was like, well, Blood Ties has been around for 10 years and they offer clean needles and I haven't gone to do heroin in that time. It hasn't promoted me to do it because I'm not interested in doing it.
Exactly.
So the people are going to do it.
Yeah. So the factors that put a person vulnerable to, say, injection drug use or illicit drug use are really complex. And so, I mean, it's not, people's behavior around these kinds of things is not as simple as monkey see, monkey do. Like, oh, here's a needle. Like, let's all go mainline injecting now, right? Yeah. Like, so same with, things we know is like you might take a whole group of teenagers and they all may experiment with marijuana when they're 16 years old, which is a fairly common Canadian 16-year-old experience. Mm-hmm. And what are the factors why one of those teenagers may go on to do harder drugs, and why the other 9 will not, and what is it about that particular teen and that kind of thing.
Or maybe even just that one teen may abuse marijuana and he may continue to use it every day, whereas the rest might once in a while.
Yeah,
kind of
once in
thing.
a while, only on
Yeah.
weekends, and that one winds up going to school high every day
Yeah,
and flunks out of
exactly.
math, right?
Yeah.
So, they're really complex issues. And so the provision of stuff like clean needles and good education isn't what makes or breaks the decision to use injection drugs. It's not like if there was suddenly no clean equipment available that people would use less. All we know is that people would reuse dirty needles, and their risk of HIV and Hep C infection would go up. Their health risks would go up, and the cost to the healthcare system would go up. That's what we know to be true. Everything else is not true. So, yeah. So harm reduction is a really important philosophy, and our agency uses it as one of our foundations. It's a philosophical foundation, and from which we operate. So when a person comes to Blood Ties to use our services and programs, we're not invested in a particular outcome for the person, in the sense that we're not invested in their sobriety or their abstinence. And we are invested in the best possible health outcome that we can help them achieve, with the recognition of their right to self-determination. And by that, we mean people have the right to choose to make choices for themselves. And it's our responsibility as a community to give people as much information as they can so that they can make the choices that they want to make. But at the end of the day, we can't be, emotionally invested in, John's sobriety or John's not
so
sobriety.
You're not actually you're not trying to cure any addiction or any drug use or any mental illness that comes your way. It's just about assisting the people who have these problems in using clean equipment.
In having access to good equipment, to having access to good knowledge, and to having access to support services.
Right. So you're helping educate people as well then?
Yeah. So harm reduction, one of the principles of harm reduction, sometimes people think that the only thing that happens with harm reduction is we give you a clean needle and it's like, have a nice day.
Right.
But we do a lot more with harm reduction. One of the programmatic pieces of harm reduction that goes with it is the education piece, and it's pretty essential. So making sure that like, for example, my workers who might give out clean needles, they need to understand about stuff like there's parts of the body that are safer for injecting than other parts of the body. Sure. So there's like green zones, yellow zones, which are kind of like, don't inject in those parts of the body if you can avoid it. And red zones, like, don't inject there. It's highly, highly dangerous, right? So workers need to know that so that if they're talking to a person, they can give that information. Like, don't inject in your wrists because that's a highly dangerous place to inject.
Why is that?
But you can, it's just, like there's all kinds of body parts. The neck is also not a good, this is a highly dangerous place. The arms is a green zone. So the idea is just to talk to people around, well, here's a needle. And by the way, can we talk, let's talk about, do you know some of the parts of your body that you should be avoiding for injecting?
Sure. I mean, you hear those horror stories of people who have no usable veins left and then injecting into their forehead or
right. And
whatever.
And that's another piece of education that goes with it, is when you're talking to people who are doing lots of injecting, is talking to them about saving at least one vein in their arm. Don't ever inject into that vein if you can avoid it, because if you're ever in hospital and you need an IV or whatever, then the hospital staff can access a good vein, and so that they can get you what you need. That's important information. Stuff like, for example, you might have a person who is using drugs on the street, and maybe they get picked up by the police and they get thrown in jail. So they get thrown in jail and they might spend, say, 6 days, 6 weeks, 6 months, whatever, in jail. And then they get out of jail. And sometimes what can happen is when they get back onto the street, they go to score and use drugs again. And they might use the amount of drugs that they used before they went into jail. So that's
tolerance.
Yeah. So there's really a high risk. So one of the things that we know when you look at drug overdose statistics is a large number of drug overdose statistics are people who were recently incarcerated who are back in community.
Oh, is that
Because what happens is they're using the same dose that they had grown accustomed to. It's like, if you drink 3 beers every day,
Yeah,
you get used to that, and then you don't drink 3 beers for 3 months, and then you have 3 beers, you kind of get get a pretty good buzz on,
Yeah.
So we see, so those kinds of education pieces are really important. So it's not just about giving out the right equipment at the right time and making sure it's available to people, but it's also making sure that you have the right messaging and the right education and helping people to reduce their risk. And it's also about a preservation and an acknowledgement of the person's dignity and self-worth, which not every person who uses illicit drugs brings that for themselves, but we always attempt to bring that to them anyway, whether they have it internalized or not. It's really important to...
Is that sort of a non-judgment thing?
It's accepting the person in a non-judgmental way. And like I said, not being invested in outcomes. Like we don't like John more or less, whether he's using or not using. We don't judge him if John decides to not use anymore. It's like, great. I hope that's going to work out for you, Right. And if John doesn't successfully manage to remain abstinent, because abstinence is a pretty hard construct.
Oh, yeah.
And so if he doesn't manage, we're not like, oh, John, well,
I see. So you're acting as sort of a support for these people as well.
Yeah, we're support. And then referrals is an important part of harm reduction as well. And that's where people often, when they are ready to quit, one of the places that they'll often go to is where they were getting harm reduction services. And so making sure that our harm reduction service is able to provide the right kinds of referrals and supports over to detox and drug treatment programs is really important.
You're kind of a network with the other people.
Yeah. So we try to make sure that, so if we have a client who is ready and is talking about getting moving off of drugs or alcohol and stuff like that, we do provide assistance to getting them over to detox and those kinds of things in the medical health clinic and stuff like that, because it's an important part, because again, it's always about acceptance wherever the person is at on the drug using continuum, and it's about trying to reduce harms wherever they're at on that continuum. And sometimes it's about trying to help them move down that continuum, and sometimes it's about trying to help them reduce the harms, even if they're a heavy user. So stuff like chaotic and problematic drug use, we try to talk to people about trying to stabilize their drug use, so it's not so chaotic, or it's not so bingy, that kind of thing.
To try to function a little better.
Yeah.
Well, even though they're still currently using.
Yeah, that kind of thing. And same with, for example, we have a Safer Crack Kit program, which is giving out clean and new pipe kits for people who smoke crack cocaine. Right. Now, why do we do that? Well, one, sharing used and dirty crack pipes has been linked to sharing of hepatitis C. And the other reason why we do that too is because it actually works for harm reduction, because sometimes people who are injection drug users will move away from injection drugs to inhalation drugs if we provide them with the right equipment. So instead of injecting drugs into their veins, they smoke it instead. Smoking is always safer than injection. Always. So if you can move somebody away from injection drug use into
so why
smoking,
is it always
it's safer? Because the risk of overdose is significantly reduced.
You can't get as much as fast? Or?
Yeah, because it's not going directly into the vein, so you're inhaling it, so it's getting into the lungs. So the risk of overdose is much more reduced, because you can inject. And you can inject way too much into the veins, and then you can be in real trouble. So, one, it's safer that way. Two, the risk of HIV transmission is significantly reduced. And there's a small risk of Hep C transmission, but it's still much less than sharing a needle.
It's not blood to blood.
It's not blood to blood.
Yeah.
So you're reducing a whole lot of risks. for the person. So,
And so what are the actual drugs then? Like, obviously people inject heroin.
yeah, but
you
it's not there's not a lot of that up here.
There's not a lot up, okay. So it's a lot of crack cocaine?
The drug of choice in Whitehorse tends to be crack cocaine and morphine.
Morphine?
Yeah.
Rather than heroin?
Yeah, there's not a lot of heroin in circulation in Whitehorse.
So how do people take the morphine?
They will inject it.
It's injected.
Or they will take it in pill form. It depends on how they're buying it and stuff like that. Huh. But so opiates of choice tend to be morphine, and stimulant of choice tends to be cocaine.
I see. Mm-hmm. So let's get back into the Canadian Drug Policy Coalition. Is that the correct word? And your involvement in that. If you could just briefly explain again what that coalition does and just your involvement with it.
Okay, so the Canadian Drug Policy Coalition is involved in changing and scrutinizing and looking at drug policy in Canada. And what kind of drug policy, like for example, when you think about the rhetoric for drug policy in Canada, one would say that it's, tough on crime and enforcement. And we take basically an enforcement approach. In other words, people who are involved in drug crime go to jail, and we throw people in jail.
Like a deterrent sort of.
Yeah, and it's how we're handling the drug issues in
making
Canada.
People criminals for.
Yeah, you're criminalizing drug activity and drug users. So the Drug Policy Coalition looks at it and says that we should be rethinking our approach around drug policy. And rather than taking a punitive, criminalizing approach, we should be looking at drug users from a social health, a social and public health perspective instead. And so, if you have a person who's on the street who's a small-time dealer dealing drugs, it's probably because that small-time dealer dealing drugs is addicted to drugs himself or herself. And so they're selling a bit of drugs to make some money to get drugs because they're
their own use.
To continue their own use.
So even the people selling the stuff, generally they're having issues, whether it's financial or whatever, mental health of some kind.
Well, chances are they have an addiction. Yeah. So I mean the small time dealers. I'm not talking about the big time dealers. So the small time dealers. So what we do is we get those people and then we throw them in jail, and we throw them in jail for 3 months or 6 months or maybe a year or whatever. We don't provide them with treatment. We don't provide them with any treatment access around addiction. We don't provide them with counseling or counseling support. We don't provide them with any kind of real programs. And then they get back out on the street and they have the same problem and the same issues going on.
Yeah, it sounds silly when you put it that way.
Yeah.
What are we hoping to accomplish by throwing them in prison?
Exactly. Besides using up your and my taxpayer dollars.
Yeah,
so,
exactly. Yeah.
So that's what we were doing. And then, Canadian Drug Policy Coalition and advocates for drug policy reform, which I'm one of, and Blood Ties, our organization, stands for drug policy reform, is that we need to start looking at how we deal with drugs in our community in a different way, because the way that we're currently dealing with it is really ineffective. Mm-hmm. So criminalizing drugs costs us an awful lot of money, doesn't give us the outcomes that we want. Because if it did give us the outcomes that we wanted, it being tough on crime, drugs, gave us the outcomes that we wanted, we would have, the drug war that was started in the 1970s would have been won by now.
We've been trying it for quite
40
a while.
years. So we're 40 years into a drug war and there's no end in sight. So
there's really not even much change. Maybe
nothing's changed except for the fact that the value of drugs on the streets is worth 300,000 times the cost they are to produce. Like when you think about opiates like poppies in Afghanistan and what it costs to grow poppies and what the street value of heroin is, it's 300,000 times the value. So that's all we've accomplished, is to make really big time drug dealers really wealthy.
Right, which gives them a lot of power.
And we've kept cops busy with things that are stupid and that they could be doing better other things with their time.
Sure.
And we're clogging up our jail system, and it's costing taxpayer money. So drug policy reformists were like, maybe we could be thinking about these things differently.
Right. So this is the coalition that you're a part of that is just trying to promote this idea.
We're trying to promote a way of thinking, of being critical of policies that do not promote harm reduction. So, for example, right now, the federal government, under the Harper administration, is not progressive towards harm reduction and progressive drug policies, and instead they are they lean heavily on punitive approaches to drug problems. So
right.
Throw them in jail,
tough on crime,
tough on drugs and stuff. Yeah. And they have an idea that you should be putting people in jail for longer. And
right. Yeah, I'd heard maybe like mandatory minimums for marijuana possession or something recently.
Well, yeah, mandatory minimums for sentencing and that kind of thing. So these are all policies that from the Drug Policy Coalition Alliance and drug reformers, we're looking at those policies and saying, these are not working. And they didn't work for America 40 years into the drug war. And now they're not going to work for Canada either. And so why are we doing this? And we should be really thinking about it differently. So, for example, we were talking earlier about harm reduction. And one of the things that Canada has in one place only, which is in Vancouver, is a safe injection site.
Yeah.
So you might be familiar with the safe injection site. And a lot of Canadians are, because it's kind of like, oh, what is,
You've heard about it.
So you heard about it. So in Vancouver, in the downtown east side, where there's a large concentration of people who use injection drugs, they opened a safe injection site. So it's a place where people can go and inject safely under supervision, where there's nurses available so that in case the person overdoses, they can get immediate attention and they can inject in a safe environment so they reduce their risk, overdose, abscesses, health issues, and HIV and Hep C transmission. So it's serving its purpose. And in its time since it opened, it has saved many lives from overdose. And so it's a good...
That's called Insight? Is that?
Yeah, it's called Insight.
Yeah.
So one of the things that Insight's been running for at least a decade now and doing good work. You might want to be tempted to ask me, Patricia, why don't we have more safe injection sites in Canada?
Right.
So that's a good question, Carl. Why don't we have more safe injection? Because we have drug policy. So ever since the Harper administration has been running the government, they have been trying to shut down the safe injection site in Vancouver because they don't like it. It's for them, they see it as...
It's like a threat to their mindset.
They see it as a threat to the mindset. Like, why would you have a place for people to go and inject drugs? Our philosophy is you take people who are using drugs and you put them in jail.
Yeah.
So it flies in the face of their political views around drug use. So they've been trying to shut down Insight for a long time, and they have been not able to succeed through the courts. And in fact, it went all the way to the Supreme Court of Canada, where the Supreme Court of Canada upheld Insight's right to exist and to provide services in that community. So as soon as that happened, other communities in Canada were interested in opening up their own safe injection sites because they are needed. Like, for example, Toronto could use one.
Right.
Montreal could use one. There's been some talk that probably Ottawa and Quebec City could use one as well. So why don't we have them? Well, what happened was as soon as the Government of Canada lost at the Supreme Court of Canada, they passed a bill under Safer Communities, under a crime bill, and buried in that crime bill was basically a legislation that would prevent other communities from being able to open up safe injection sites, because there was this out in it, a clause in it that meant that if any other community wanted to open one, that they needed permission from every single person in the neighborhood to agree to have a safe injection site, including, faith-based community members and all that stuff. So, so you all of a sudden they have all these barriers in the way, because safe injection site is a difficult program to explain to lay people to understand why it's a good thing, right?
Yeah.
So, you kind of need some time. Your average person who doesn't know, they kind of need some time to be educated around it. So if suddenly it was like, well, we're going to open one in your backyard.
Right.
People would be like, no way,
There's
right?
be heroin use in my backyard? No
Yeah.
way.
So,
Right.
so anyway, so this is the problem. So when we look at drug policy reform, we're looking at ways to move those kinds of policies and not have these kinds of policies, and have more progressive policies where we can have safe injection sites in Canada, where we can have more harm reduction, where we can have a reduction in penalties for petty drug dealing when we know that drug dealing is tied to the person's own addiction. And like, we're not saying, oh, large drug dealers shouldn't be incarcerated. That's not where we're going.
Yeah, there's a difference between someone who's running a huge sort of, I don't want to say empire, but a big gang of some kind who is really importing the stuff and exporting and moving big business. And because those people they're probably most likely have their hands in other illegal things too, you know.
Right.
And it's a much different picture than someone who's just selling it because they're broke and also addicted, and they're using it anyway, and they have a bunch of, they know they have the connections already made to the people selling it, and so they kind of just get in on the business.
And it's just to supplement their own habit, right?
Yeah.
So, and the other thing that drug reform movement looks at is ways and where we should be looking at the legalization or the decriminalization. So, for example, in terms of marijuana, the Drug Policy Coalition stands firmly on the fact that we should be decriminalizing marijuana and moving it into legalization in a regulated substance in the same way that alcohol is a regulated substance.
Right.
And there's been some conversation started in the drug policy reform movement, both in Canada and in the United States, around other illicit drugs that maybe we should be decriminalizing and moving into legalized, and so that they become controlled substances.
Right. Yeah, marijuana is an easy, like it's a silly one. I've had the discussion of marijuana so many times now. When you look at all the points, it's just very silly, as if by having it illegal, what it's basically saying is that this substance here is too dangerous for anyone to even try it. Even a doctor can't prescribe you marijuana because it is so dangerous.
Yeah.
Yet it's not the case. It's just not.
It's not the case, right? Like alcohol, in my opinion, I think is a far more dangerous substance.
Sure.
And
in terms of just physical dangers
in
to
terms
the
of
body,
physical dangers and stuff like that. So, and then when we start having that conversation, we really need to start having the greater conversation around other illicit substances and why they've been made necessarily illegal, and maybe we should be starting conversations about if there's room for some of them to be looked at more critically and moved into zones of legalization or not. And
right,
so this is stuff that the drug policy reform movement is standing behind, and these are where the conversations need to happen. And in the United States, they've had a war on drugs for 40 years, and it's really been a problem. And so the drug policy reform movement in the States has been making some real gains, as you know, because in the state of Colorado,
right, in a few
in
states
Washington now they've legalized marijuana, and Paraguay has also done the same.
Yeah, right.
And I think depending on who's going to be the next leader in Canada, it might make a big difference as well. Right now we know the Conservative government is not interested in looking at drug policy reform, and but perhaps another government would be.
Right, and that might happen. It's funny, the coalition, like it sounds like, at least from your perspective, which is understandable because of your work with blood ties, but you're coming at it from a point of view, very, very like harm reduction point of view, especially in terms of these drugs with a heroin or a crack cocaine or these very physically dangerous drugs. And I come at it from, I talk about that as well, but I come at it the same issue of drug policy reform from things like marijuana and a lot of these psychedelic drugs, these things, magic mushrooms or LSD, MDMA. These are now becoming known that they have the potential to be used medicinally. So not only is it like reducing harm, but there's potential for these things to be used to people's benefit, if they're used in the right way. And that's if we can change the policies so that instead of people only being able to get magic mushrooms from dealers on the street, we could set up clinics and people are finding like MDMA and these psychedelic type of drugs are useful in treating anxiety disorders, depression, post-traumatic stress, and this sort of thing. And if the right policy was in place, maybe the model isn't that they're like fully legal, but if they're at least legal for people to use sort of clinically or sort of, in a controlled, responsible environment with a nurse present or in these situations.
The thing is, like it definitely would be better than what we've got right now, right? Which is, it's the price and the quality is controlled now by people who are running illicit schemes and making a massive profit and actually don't really care about the health of you and I. Like I think the person who's putting cocaine on the street and cutting it with dewormer doesn't actually really care about me. No. If and my addiction, say, for example, if that was my addiction and all they care about is the fact that they are cutting cocaine now with dewormer because it's really cheap and they can get more they can get more blowout on the street and get way more money and that kind of thing. Well, nobody's looking after me in that regard. So the government doesn't care about my health because I'm an addict is how it's seen and I should be thrown in jail or I should just, I don't know, get a job or something. Like it's really, there's such simplistic thinking sometimes with that rhetoric. It blows my mind. Yeah. Then the dealer doesn't care. So perhaps if we moved it into a controlled environment, like you said, whether it's administered by a nurse or whatever, but something's got to be better than what it is right now. Because right now, the lives of individuals, the individual person on the street with an addiction, his or her life is not in being regarded by anybody in a positive way. The drug dealer doesn't care about that person, and neither does the government. We have to change that, and we have to start saying as a community that we care about these people, and they have a right to have a dignity and a life of value, and that we have to look at addiction in a different way, and we have to decide that we're going to tackle it in a way that is more humane. Because right now, it's lacking in humanity.
Yeah, I mean, there's a lot of points there. I agree with. I mean, just on the very baseline, you could just say, like what we have with alcohol now is that alcohol percentage is listed on the bottle. So you know exactly what's in it. And you're not going to buy moonshine at the liquor store. You're not going to get some random, but that's what we're getting with crack cocaine is like moonshine. It's just this random mix of white powder that you don't know what's in, or you get a little pill and you don't know exactly what it's cut with. And there's no bottle with the percentages and the dosage.
And now with marijuana, because sometimes your marijuana might be laced with something else too, and you don't know. And
putting that into the drug dealers' hands, the criminals' hands to dose people correctly or give them the correct information. People aren't being educated. And the addiction is a huge part of it. Of this whole the whole sort of trifecta here, because it's people's perception of what addiction is that sort of can create the separation between them and the addict, and they don't have the sympathy for someone who does drugs because maybe they see it as just a weakness, and that person, is up to them to overcome that thing. But I think a lot of it comes down to a support network, and a community support, I think, is a big part of helping people through addiction. I mean, it seems like when addiction comes up, it comes up in the people who have dealt with a lot of pain and trauma in their life. I mean, from what I've seen and experienced myself, that seems to be the case. Is the difference between those 5 teenage boys and the one who ends up smoking marijuana every day, and then the 4 who don't. The one who does it every day might have like a really shitty home life or something that's causing him to want that escape. And whatever, for everyone it's different. Everyone has little addictions. And
and if we don't even address that, like what might be going on for that kid. Yeah,
if we just look at it like, oh, he has like different brain chemistry, so he just got hooked, and that's all it is. It's not, we have to look at it like, oh no, there's probably something else going on if he's addicted. It's not just the drug's fault. Like, I don't know if, I mean, you've worked at Blood Ties for so long. I don't know if do you hate crack cocaine? I mean, you may after seeing its effects. I don't think the drug itself deserves the blame or the hatred or fear even. It's what's behind the drug use. It's the cause of the drug use.
Yeah, no, I don't hate crack cocaine. I don't hate any drugs or alcohol. What I hate, though, is the fact that we continue to make policies that are ineffective and aren't evidence-based. So I hate that. I hate the fact that sometimes as a community, we think of people who use drugs or people with addictions as it being like their fault, like, and that,
Sure. There's
he
a
or
lot of
she.
that.
So I hate that. And I hate hearing those arguments. I hate the all or nothing dichotomy where it's like either you're using drugs and therefore you're an addict and you're dirty, or you're clean. Right. And like that word clean,
Even the word,
is so loaded. And so you're clean and you're sober and therefore you're a good person worth loving. And I hate that because, addiction is, and drug use and substance use is really nuanced. And I also hate the thinking that we have that certain drugs are these potent devil forces. So we also have this thinking, like, I can't tell you how many times I've heard in my life where people have said, oh, heroin, like, if you just try it once, like you're instantly addicted. Crack cocaine, like, you just take it once, you're instantly addicted. And it's like, that's not true.
No, and I think that's just an ignorance sort of thing.
And so there's this huge like fear stuff set up with it. There's a real lack of understanding. So I hate those kinds of things. I hate those kinds of
sort of naive understanding.
It's that we don't talk about it in a critically thinking way enough. We don't have good language for it, and blame the drug user. Like all that kind of stuff is what I hate. But crack cocaine itself, do I hate crack cocaine? No, I don't. And I work with people every day who love it, and right. and I think we need to talk about that too, right? That people who use substances. Some people who use substances hate their relationship with substances, but some people love their relationship with substances. And I'll tell you, if I lived some of the lives that some of our clients at Blood Ties had lived, I would totally be loving crack cocaine as well. Or alcohol. Like if I was taken from my family and forced into residential school, and if I was inflicted with trauma and neglect and isolation and a loss of my family and my culture and any one of those things, or if I grew up in a family where that had happened to my mother and my father, and so they were disconnected from me. If I was marginalized every day by the color of my skin for being a First Nations person in this community, or marginalized every day from the associations with my family or my language or any of those things, I'm telling you, a relationship with cocaine or a relationship with alcohol or a relationship with any other substance kind of makes sense. And, I think we sometimes have to think about those kinds of things. Like, every morning I wake up and I go to work to a 9-to-5 job, but every morning before I get up, I have a nice cup of coffee and I have a relationship with that cup of coffee, right?
Yeah, coffee is for a lot of people.
Do you know what I mean? And it's like, it makes me happy. And it makes me happy given the fact that I live in this 9-to-5 grind of, and we all do, and all that stuff. So it's the little things that make us happy, right? Yeah. So when you think about a person who has a really hard time finding happiness because of so much of pain and misery that's in their lives, or and I'm not just talking maybe that they're residential school survivors, but if they're living in poverty or dealing with chronic in and out of homelessness or housing insecurity or having to trade sex for a place to sleep and all those kinds of things, it's like, it starts making sense why maybe some drugs and alcohol make them happy in the same way my coffee makes me happy,
totally,
kind of thing.
Yeah, it's all levels. It's all. I think we all have little addiction, little things that just give you that feeling, like whether it's you go buy some new clothes on the weekend or something that just makes you feel good for a moment, relieves that stress, that anxiety, that pulling, nagging feeling of whatever's bugging you, and everyone has that. And I think you have to understand. Like you say, you just put yourself in their shoes, put yourself in a heroin addict's shoes, ask them about their story or find
ask
out
them their story. Yeah.
Why is it that they are doing this? And I think it'll be you understand pretty quick. It's not that unreasonable. It's not that hard to understand. Like I've heard people describe when they talk about, like an addict will talk about the feeling they get. It's like, they describe it like a warm hug or something. Like this warmth, this comfort, this, nice feeling that they're sort of missing. They're missing out
and it's something they can rely on.
Yeah, it always bring them back there.
Yeah. Yeah. So, when we think about it in those ways, I think it can kind of change the way we have dialogue about it. And I think, as long as we don't know yet really how to develop healthy communities, which we're still struggling with on how to develop a healthy community, we're going to have addiction and problematic drug use in our communities. And so we need to look at that. And so, and until we have that, we need stuff like harm reduction, and we need harm reduction support services.
Right.
Like we need blood ties, and we need organizations like Blood Ties everywhere, because we don't have perfectly healthy communities. And so we have people who need services that organizations like mine provide.
Right. And that's the way to look at it, I think, is to look at it as the greater community, and not look at like separate yourself from all the people with problems and think, oh, it's just that group of people who have problems. If people in your community have problems, that's a reflection on your community and you're part of that community. So I think we all have to sort of start taking responsibility for our own communities, helping those who are on the lower end of the communities, who are getting the short end of the stick, so to speak, and just sort of step up and start really taking accountability and responsibility for the community as a whole.
Absolutely.
Yeah. Alcoholism is a big one too, and alcohol is a legal one. But compared to these crack cocaine and morphine, I guess is what they're using up here. But alcoholism is actually one of the biggest problems up here, I think.
Yeah.
And I assume a lot of the people you work with at Blood Ties, they probably have more than one substance that they're turning to.
Yeah, definitely. I mean, I think when we're talking drug of choice, like I said earlier, the drug of choice in Whitehorse is more around crack cocaine and morphine, but that's in the illicit, illegal category. But really the drug of choice in Whitehorse, I would say, is first and foremost alcohol.
Yeah,
and it really causes a lot of problems in people's lives.
I suppose,
we don't have good. We don't have good policy around alcohol. Like, we do have it as a legal substance, but we obviously still don't have it right either with alcohol on how to help people with alcohol addiction. I mean, we put people in 28-day programs, we put people in AA and, that kind of thing, but we don't do harm reduction around alcohol. And there are such things as harm reduction programs.
With education, I suppose.
Well, no, there's some real actual programs that are going on in Toronto and Ottawa and Vancouver called managed alcohol programs, which are really progressive and a really good way to work with people who are chronic alcoholics.
I mean, obviously you're not just giving out clean glasses or something like that. It's not the same sort of...
No. So a managed alcohol program works in such a way, it's meant for people who are what you'd call hardcore chronic alcoholics. So these are people who have had time and again, like it's wrecking their lives, and it's wrecked their lives. So what you do is the program involves giving them one glass of, usually it's wine, and you get one glass of wine every hour on the hour usually from about 10 a.m. till about 9 o'clock at night. Wow. And this reduces them binge drinking, which causes problems. It reduces the person from drinking what we call non-alcoholic beverages. So, non-beverage alcohol is what it's called. So people who drink like Listerine and cough medicine and stuff like that, non-beverage alcohol.
Must be terrible.
It's awful, right? You want to talk about wrecking your life. Yeah. So it reduces the amount of people drinking that. It reduces binge drinking. And binge drinking is really important because reducing binge drinking, because that's when people start getting, blackout drunk, blotto, falling on the street. That's when ambulances are called. That's when emergency room visits need to take place.
Yeah, alcohol poisoning.
Alcohol poisoning. This is all the stuff that costs the healthcare system an awful lot of money. And that is also visibly a problem in our community because people see, you know, the drunk on the street passed out in the door frame and stuff like that. And people don't like to see that. Right.
Sure,
So, and I don't blame them. Like, I'm not saying, oh, we should want to see that. I don't want
no.
to see it either, you know? And
No, and it should make you feel bad.
It should make you feel bad.
Yeah.
And it, because, you know, when I see that, I think, oh, we're not getting it. We still don't have it right, you know,
right.
like, because that's a human life. So managed alcohol programs provide a person with a place to live. So they're usually in a supportive housing situation. They have a place to live and they have alcohol. And it's given to them every hour on the hour. So
it sounds really extreme.
I know.
Alcohol
I know.
on the hour, every hour. Like,
because most of these people are hardcore chronic drinkers who are used to drinking substantial quantities of alcohol daily. So for many of them, when you put them on the one drink every hour on the hour, and it's usually for 10 to 12 hours, and they go to bed, for that person, it usually is still a reduction in the amount of alcohol that they're used to consuming. It's so hard
to imagine.
I know, because can you imagine you doing this every day of your life? Like every day you're going to wake up and have a drink every hour on the hour.
When you do that, the withdrawal from alcohol is actually really dangerous, isn't it?
Well, this is what it does. It manages withdrawal. So this keeps the person from going into, from getting the DTs, from bad health outcomes from withdrawal. It and it's been shown to be very effective reducing ambulance calls, emergency hospital room visits, problems with the criminal justice system.
Right.
It eliminates and decreases all of those things, and it decreases consumption of non-beverage alcohol, which is really good.
But it's not necessarily aiming to cure the person.
It's not at all. The goal. It's not at all. This is the person who goes into a program like this is the person where every other alcohol drug treatment program has failed them.
Right.
And you see how I said has failed them, not that they failed it, right? Because that's another rhetoric that we have in community around. Oh, they failed drug treatment. No, the person didn't fail. The program failed them, right?
Sure.
So these other programs have failed them, and managed alcohol program seems to work for them.
Yeah, there's this idea of rehab centers of just like people, if you don't know and you just think, oh no, rehab cures addiction. So if you go to rehab and if you didn't get cured, it's your fault. Like you must have not paid attention during the classes or whatever. No, you didn't take part in the sharing circle. And you didn't,
the recidivism rates for traditional drug and alcohol treatment programs is quite high. And like very high, greater than 50%. So when you think about that, we have this model, like this 28-day model that we keep pushing. And it's a model that we keep spending money in. We keep putting people in that in programs like that. When the program fails people greater than 50% of the time.
Over half the time, it doesn't work.
And it's like, why aren't we having a conversation
we should probably
about
try something new?
Like maybe we could try something new, right? Because we're not having a conversation about that. And so what we know is, you know, these abstinence-based only programs don't really work very well. On the issue of alcohol and in our community, we have a problem with alcohol in our community. Not everybody who has a problem with alcohol would be a candidate for a managed alcohol program.
Sure.
But there are some people in our community where they would be a candidate, especially if we gave them supportive housing with the tied to the program. That's
right.
That's
a big
need.
part is to get out of like whatever sort of little
the street.
Yeah.
The street and hanging out around the liquor store with the crowd, and then you guys are all huddled together around a bottle. Like you got, you know, but right now that's all they've got. So who am I to say, well, give that up, walk away from that? Like to what? Like
yeah,
to what?
exactly. You need something to replace it with.
Yeah, and if it's 30 below and you're homeless, you know, a bottle of alcohol is going to keep you warmer than if you don't have a bottle of alcohol, you know? So.
And it's the sort of, you make friends with that group that you're with, and then that's your social circle, right?
Yeah.
Like you get bored. You try to do something new, but you don't fit in with the sort of sober crowd, and it can be tough. I know it can be tough because you have to replace the social circle and the activity that you're doing all day, and you're sort of and replace maybe that feeling too.
And maybe in a big city like Vancouver, it's maybe a little bit easier to go find a new network and stuff. But I don't know. I don't think so. I don't, but it's
Yeah.
certainly not that easy in a place like Whitehorse.
Right. Yeah.
You know, like
It's too small of a community.
it's a very small community.
Yeah.
So yeah, so we need to be doing better with how we deal with alcohol and alcohol addiction in our community. That is not an area of expertise that Blood Ties has.
Yeah.
But we do support and endorse the idea of a managed alcohol program. We think something like that would be valuable in our community in the future. Yeah.
And I just wanted to ask you as well, just because I mentioned like part of why I'm doing this project here and I'm talking to people like you is because I believe that a lot of these drugs that are illegal, not like, I would say that all drugs have the potential to be used responsibly and to benefit in some way. Even like I've spoken about cocaine before, where cocaine comes from a coca leaf, and in Peru they chew coca leaves for altitude sickness, and so in certain ways, and of course they use morphine in hospitals, and so all of these substances have their use in the right situation. But what I'm really a big part of what I'm talking about, I'm about to release some more content more in this regard, is promoting the idea of a lot of the psychedelic drugs specifically having a medicinal or therapeutic potential for people. And I just wanted to ask you, do you see many people come to Blood Ties who use like a lot of LSD or psilocybin mushrooms or ecstasy maybe?
No, because we don't really have harm reduction equipment and stuff for them that would be applicable.
Sort of a different animal, I guess.
Yeah, so it's kind of a bit of a different animal. But I am aware, like you are, of how there are some of these substances that have been showing some really amazing health outcomes. And like, for example, there's that one, what's it called? You know, the one that's being used to treat addiction. It's
ibogaine?
No,
ayahuasca.
Yeah,
ayahuasca
that's being used to treat addiction, and how you know revelationary that seems to be, and you know, I think
it has a very high success rate.
It has a very high success rate for treating addiction. So you know, we should look at that, right? But we're living in a drug policy climate where we're not able to really look at that, but we should be. Like, we should be looking at that kind of stuff. Marijuana, for example, like Blood Ties' roots is in the HIV/AIDS movement. And of course, marijuana has been shown to be tremendously effective of helping people living with HIV manage their symptoms from their HIV meds. So, you know, because
the sickness or queasiness that
the nausea and stuff, because HIV meds save lives. But some people can have some pretty difficult side effects with them, including a lot of nausea, sleeplessness, you know, all that kind of stuff. And marijuana has been shown to be very effective in helping people with HIV manage their symptoms, their side effects from their medications. And so, yeah, we know that there's more and more bodies of evidence that shows where marijuana has been particularly effective in helping people manage symptoms of all kinds of different conditions and health related issues and stuff. And so, yeah, and I know now that they're talking about MDMA as being a very effective tool, and ayahuasca, and, you know, so we need to, you know, broaden the conversation around that, but we're just living in such a difficult climate right now for having those kinds of conversations.
Hard. I mean, I've heard it said that the war on drugs, it's not stopping anyone from using drugs. I mean, there's drugs in high schools and there's drugs in prisons. So I mean, it's not actually stopping the drug use.
Yeah, they can't even keep it out of prison. Think about that, right?
Exactly. Yeah, the most regulated place in our society. But what the war on drugs is actually doing is it's preventing like scientists from researching. It's so hard to research any of these things when they're made illegal like this because you can't get permission from the bodies involved. So
what brought you to this project?
A few things. A lot of personal experience with sort of all aspects of this. For me, like my father has been an addict his whole life. So, I mean, I've seen it through him. I've seen that he has been an addict. Where he lost his voice. He had throat cancer from smoking his whole life and had his larynx removed. And then he was a gambling addict and still has been a gambling addict his whole life. He's currently a crack cocaine addict as well. Which is, it's funny when he describes it because that addiction for him is like, it's only when he has money that he's an addict to crack. Like, as soon as he gets money, then but the rest of the time when he's broke, he can go without it. It's kind of and that sort of thing points to the fact that it's more of a mental health problem than just a physical whatever. But so I've seen it through my father, and I've been addicted to certain things, have habitual sort of addictions that haven't been so much with substances, but with computer gaming, and which is similar to gambling, but all like marijuana as well. I've abused marijuana in the past, and I've seen addiction through my own experience. And then I've been able to use things like psilocybin mushrooms myself to help me cure that, help work on that stuff. And I've seen the power that those have in regards to making people aware of their behavior and why they're behaving a certain way, and really getting to the root of some of the things. So that's what really brought me to this, and what I want to sort of spread the word about is that some of this stuff isn't as bad as we make it out to be, or that people believe it to be.
Good. Well, good luck with the project.
Yeah, thank you so much. Thank you so much for talking to me too. I really appreciate it.
No, it was great. Yeah.
All right, everyone, that's it. That's the podcast. Thank you so much for listening. If you'd like to find out more about either of the organizations that Patricia works for, you can check out bloodties.ca or drugpolicy.ca. And for more from me and the work that I'm doing, check out changetruth.com.